Well, there's been very little to celebrate in this pandemic, but today there was some cause to smile. New South Wales has surpassed the Premier's target of 6 million vaccinations, and it's come a week early. But the achievement has been tempered with news of yet another COVID death in Sydney, a woman in her 30s. The case numbers remain high, but they are slightly down on yesterday. A little later, I'll talk to the Premier about what happens next. But first, state political reporter Ashley Raper begins tonight's coverage.
A task was set and now the target's been met. 6 million vaccines have been given in New South Wales.
To have so many people who otherwise may not have wanted to get the vaccine to come forward and get vaccinated has really lifted our spirits.
The rates have increased the fastest in many of the virus hotspots.
Blacktown has done an amazing job. Burwood, Fairfield, Canterbury and Bankstown, these suburbs have gone to very low vaccination rates, to some of the highest in the state.
The Premier promised at least one freedom for those vaccinated for achieving the 6 million target. And while that hasn't been decided, it has people hoping
that at Christmas time, anyone that's been vaccinated can get together for Christmas. That's all I want.
It'd be nice to have some people over, just 1 or 2 people around the house would be good.
There's been another death in Western Sydney. A woman in her 30s died at home in Emerton. Today's cases were down slightly, dropping into the 700s.
One day is not a trend.
It's 2 days and we've come down.
No. We're in here for the long course.
So whatever reward is on the way for hitting the 6 million jabs, it's still unclear whether it'll apply to everyone who's had their shots, including those in the hotspots. As the state now looks to having 70 and 80% of the population vaccinated, the government has a sobering message. Even then, all freedoms aren't guaranteed.
It may be that we actually have indoor mask wearing for years.
Another reset on what the future may look like. Ashley Raper, ABC News, Sydney.
The pressure on some of Sydney's hospitals is really starting to show. At some emergency departments, ambulances are queuing for hours waiting to admit COVID patients. Tonight, New South Wales Health has apologised for the delays.
A long, arduous night. Overworked ambos at Blacktown and Nepean Hospital were left waiting with patients for hours. As COVID cases soar, the delays, known as ramping, in Sydney's west and southwest are getting worse.
The system is holding, but it's under enormous pressure.
Additional infection control measures and the strain on hospitals are adding to long wait times.
Even in areas without COVID, we're getting ramping and we're getting hospitals that are full.
Hospitalisations have been steadily climbing since this wave began. In the last month, they've more than tripled to 608. The number of patients in intensive care is also rising. More than 100 are in ICU beds. That's about a fifth of the state's capacity. 34 people require a ventilator to breathe.
There's no doubt that our hospitals in southwest and western Sydney have the greatest pressure because that's where the majority of cases are.
The Premier says under the circumstances, the system is coping well.
The Australian Medical Association says governments need to be preparing now for the long term. While high vaccine coverage will keep hospitalisations at a manageable level, it says more needs to be done so hospitals can deal with both COVID and their normal workload.
We're a fairly long way from being able to be ready for a very large influx of infectious patients that have to be cared for a long period of time. And that planning needs to happen now.
While the curve refuses to flatten, delays will be a feature. Tim Swanston, ABC News, Sydney.
There are dozens of new cases in regional New South Wales and health services continue to be stretched. Gary John Lysard is in Dubbo. Gary, where has the virus been spreading?
Juanita, Wilcannia remains the source of most concern for health authorities in the far western region. Now, here in the Western Local Health District, 36 new cases of COVID-19 have been reported, not just here in Dubbo, but also in places like Parkes, Bourke and Wellington. That brings to 320 the total number of COVID-19 infections in the health district. Now, authorities remain concerned about a case in Bathurst that came in after the reporting period. That person had been out in the community for some time, and Juanita, testing rates in Bathurst are falling.
And Gary, are people in more remote communities still getting their basic supplies?
Juanita, it can be really difficult for people in more remote parts of the state to get even those most essential of goods. A lot of these small communities only have one or two little grocery stores, and when they become COVID exposure sites, like we saw in Bourke, they close, leaving locals with nowhere to buy food. But there's also been a lot of generosity on display. Volunteers have been out in Wilcannia recently delivering donated goods.
They desperately needed toilet paper, milk, produce, baby nappies and formula. So we went out and bought a pallet of toilet paper and a pallet of long life milk.
Similar food drops have been happening in places like Walgett and Gaduga, where the demand is likely to continue.
Gary John Lysart reporting there from Dubbo. The Premier Gladys Berejiklian joins me now. Premier, there's a desperate need to get people vaccinated in the state's far west and, of course, right across Sydney. But how long before vaccines are readily available to everyone, including outside those hotspots?
Well, obviously, Juanita, there's no doubt our priority is getting those vaccines out to those communities in far western New South Wales, and we're so pleased so many people are taking up the opportunity to get vaccinated. But in our areas of concern, it's so important to really get people getting the jab. So we're saying to everybody in those local government areas of concern, newsouthwales.gov.au, you get priority. If you book online tonight, you can get your jab tomorrow or the day after. We literally want hundreds and thousands of people aged between 16 and 39 to get vaccinated in the next week. It's really important not just to keep people out of hospital and to save lives, but also to help us stop the spread of the virus. And I can't say that strongly enough.
Do you acknowledge, though, that the booking system can be difficult to navigate and it does depend a lot on where you live?
Oh, look, absolutely. And that's why our firm direction to people, especially living in those areas of concern, is go through newsouthwales.gov.au, because that puts you in direct contact with our mass vaccination hubs, which are offering the vaccine to that age group. And we're really wanting to see literally thousands and thousands of people come forward. We already have around 300,000 people in that age group that have booked, but we're really wanting an extra couple of 100,000 to come forward so that we have confidence that those people who are mobile because of where they work or are living in households with large families, which we want to protect, are really having that priority, that opportunity. And those residents in those local government areas of concern are doing it the toughest. The restrictions there are the toughest, and this is our way of supporting them. One of the ways we're supporting them and giving them priority and saying, please do this for yourself, your family, and also for the rest of New South Wales.
Now, a lot of working parents we know right across the state are at breaking point. Are you considering opening up schools before all teachers and students are vaccinated?
Well, Juanita, this is the challenge we have. Unlike other strains of COVID, Delta is impacting younger people in a different way. So we need to make sure things are safe when we return kids to school. And I just want to say how much we feel for parents, especially single parents, that are juggling homeschooling, working from home, putting food on the table, and getting kids back in a safe way to school is a priority for us. And health and education are working really well together, and we hope to be able to give some firm direction to parents and school communities at the end of this week. So we appreciate how frustrating it's been, how difficult it's been, but I think the community also understands that given the Delta strain and the different impact it's having on those younger age groups, that it's really important for us to make sure we return school safely, but also as quickly as we can under the circumstances.
Premier, thanks for your time this evening.
Thank you, Juanita.